All right, welcome to the business of allied health, supported by CliniScribe, of course. I have Errol Lim here. He's an industry veteran, sees face everywhere on social media, having beers and I think holidaying most of the time these days. He used to do a lot of APA work. That's where I met him. Welcome, Errol.
No, Barry, happy to chat to you. Thanks for the opportunity.
Yep. So we've shared a lot of war stories and all sorts of challenges, trials and tribulations around practice ownership and just physio in general. So, would you like to introduce yourself to our audience, which is predominantly practice owners?
Yeah, Barry, and once again, thanks for having me on here. I became a physio back in the late 90s. And then I really, like many other physios at the time, I loved sports physiotherapy and really directed my focus there, especially for the first 10 years of my career. And after 5 years of working for other people, I really needed to scratch an itch. And so in 2003, I went into business for myself with a business partner at the time, but that only lasted a couple of years. And to cut a long story short, I ended up working with my older brother, who's a rheumatologist. And we joined forces some 20 years ago to build what we have now here in Sydney. So we've got 3 clinics, head office in Parramatta of Sydney, then Chatswood and Bondi Junction.
Fantastic. So that's really interesting because this is a truly multidisciplinary clinic among, like medical specialists and physios and other allied health. What
Yeah.
what brought you from running a physio clinic to
Yeah. No, that's a great question. So I think the physio clinic, you know, right at the start or the early points of the career, to be honest, I didn't know anything about business and just trying to stay afloat and do what we did well. And so that even at the early stages when I owned the clinic, we just tried to get exercise physiologists and massage therapists and different professionals in only because they had different expertise. At the same time, my brother was involved with another clinic and they were trying to do the same thing. And so they were bringing different clinicians together. And right from the start, they understood that there was not one sole clinician that could do kind of like everything in healthcare. And as we did more of what we did, we understood that especially in chronic disease, you needed a team to support the patient. And so it just made sense. And rheumatology and physiotherapy go hand in hand. They should anyway. There's not many other examples around the country, but they should definitely go hand in hand.
Was this random or was this intentional?
Oh, no. Yeah, that's a really good question. Because it's 2 brothers and it's the
Yeah.
only 2 brothers in our family, we had to make sure that this was going to work. And I remember having Dad talk to both of us and went, there's only 2 of you. Yes, this is a great idea and it makes sense. But if things go astray, your relationship goes astray as well. And maybe culturally it hurt. I think having Chinese heritage, perhaps and he's my older brother, we tend to have that dynamic, despite the fact of different roles at work.
Yeah.
He is still my older brother, and I think we've been able to maintain that sort of respect throughout our business careers.
It's fantastic. I mean, I've loved this story because it's related to I'm Asian as well, obviously.
Yeah.
I want to see how that kind of has impacted, the way you've worked with him. And what's
Yeah.
your dad do? What's his background for did he have
Oh,
business?
he's a mechanical engineer,
Okay.
and then ran sort of an engineering company for a bit, but retired quite early. Yeah.
Right. I see.
Accountant as well. Actually, it comes with an accounting background. So that was very helpful for us right at the start.
Nice.
Yeah.
Bit of a polymathic guy.
Yeah.
Like yourself.
Oh, no, definitely not. Definitely not. Yeah.
Okay. So yeah, it's just back to brothers working Asian culture in
Yeah.
Australia. Obviously, there's a hierarchy, whether you like it or not, being a
Yeah.
medical specialist versus physio, right?
Yeah.
How did that all work? Were there challenges there?
Yeah. I think that was definitely a challenge in terms of running an interdisciplinary team. And that's still a challenge, I think, generally in healthcare. I don't think there's a context where you put doctors and non-doctors together and there's no hierarchy. But what I think we've been able to build over time is making people who come together, at least under our banner, feel like they're working as a team as much as possible. Now, do we have the perfect culture? We don't. It's never perfect, and we're constantly tweaking and trying our best. But I think we find doctors who try to appreciate the multidisciplinary nature of what we do, and that requires collaboration and not this hierarchy. We don't have doctors who expect to be called doctor or anything. They're happy to be called by first names and all those sorts of things. They're pretty much your colleague. At the same time, I think if you've been around as a non-doctor, like in allied health, and you have particular specialty, you command some respect as well because you've been doing this for a length of time. So where we work, we've got hand physiotherapists, with 25 years experience. And so they, I think, have a decent amount of respect when they come into a room because they've been doing the same thing for 25 years. So I think it can work both ways, but I'm sure also with allied health, they're always very respectful when someone is a doctor. That's like a given when they walk into the room, whether that's right or wrong, that's just how it is.
Interesting. So how did you guys grow? What was the secret behind that to make that work between the two?
Yes, making so many mistakes. Um,
Okay.
so we used to think just putting people together under the one roof was integrated care. And
It's more like room rental,
yeah,
isn't it?
yeah, we well, quickly, or maybe it took us a long time to appreciate that that wasn't the case and that you had to foster teamwork and culture. By no means am I saying we've cracked it. And to be honest, I'm probably going to be able to tell you more of the things not to do than doing the right things that will make that work. I think it's so hard to actually get different professions to work together. It takes heaps of time and effort and care. And if time equates to money, then you need to throw a lot of resources at it.
Interesting. So would you say, if I listed three things, culture, systems, outcomes, patient outcomes, which of those three drive the most in terms of collaboration between like a doctor and an allied health professional?
I think culture initially, because man, it takes a bit of nous to build great systems. And yes, the systems will definitely add to culture eventually. But initially, when you're starting small and you're trying to bring people together, you're the main driver of culture. And you can have the best systems in the world, but if you can't make people work together, utilizing good human behavioral skills, you're going to struggle, irrespective of how good your systems are. Yeah. And a lot of that's just, I think, pressing the flesh, which is meeting people face to face, getting a group of people together. And that's effort.
Yeah, I noticed you
Yeah.
guys do pretty wild social events for your team.
Oh no, I wish we probably did more. I think that, yeah, these little things help. So after you've done a good event per se,
Yes,
and
yes.
you can't do too many events because then you think, oh, we'll just keep doubling down and doing events. But people just don't have the time. People are so busy and so doing more events probably isn't the right thing. Maybe doing the right event, then you get a bit of a high after that event, but it comes down very quickly as well because
It's
people
fair.
just get back into
I
the
see, I see.
treadmill. So it's then constant touch points wherever you can use it. So it could be someone's leaving, and so you run a farewell, and not everyone turns up, but as long as a few people turn up, that's a little thing for that community.
Interesting.
That's something we kind of got to be thinking about all the time.
Yeah, that's an interesting point where it's kind of like going to like I've never been, but like I'm presuming like a Tony Robbins event or something. You come out all buzzed up and then it just
Yeah,
dies out.
yeah, a little bit like your Christmas party.
Yeah,
If you have a great end of year party or end of year celebration, and you thank everyone, and it was a great 6 hours or full day, whatever you decided to do, and people interact on a different level because they're out of the clinic, and you talk about your lives, outside of work.
mm,
That's fantastic. We just love more of that, but it requires a lot. Just like any other event, say you're doing an event for your clients or whatever it might be, that's a marketing campaign. It's no different to running something internal. You need an entire marketing campaign around it. Yeah. To get engagement.
Yeah, I
Just
see.
like you're trying to get customer engagement, you're trying to get internal staff or team engagement.
Yeah. So I noticed just from this conversation that just saying, hey, if you work together, you're gonna get patient outcomes better. Patient outcomes, that is not good enough. Or it's not
No,
enough.
you notice I didn't even refer to number three.
No, 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 no,
Yeah.
you didn't
Yeah.
at
Yeah.
all, which is
Yeah.
really interesting, but it's true. I mean,
Yeah.
yeah,
Because if it's the old adage, if you, I guess, keep your team happy and the, what's the word? The makeup of that individual, the protoplasm of that individual is good right from the outset. And if you're lucky enough to hire well, so we haven't even talked about recruitment, right? But I'm making the assumption that you've brought in good people. If you've brought in good people, then it's the culture that's going to keep them happy. And if they're happy, then hopefully they'll do good work, right?
mm,
That's why then the systems come into play. So if you, I don't know, if you do, not that we're amazing at it, but if you do good client or patient satisfaction type stuff, you're measuring outcomes as best you can, you're collating it and you're reviewing it, and you've got good clinical governance, which is all the system stuff that you talk about, then of course that's going to accelerate your culture. Yeah.
very interesting. Very, very interesting.
Yeah.
All right. So for your business,
Yeah.
in your context, what's one key metric that you measure and find the most important?
Yeah. I was really, I know you gave me a bit of a heads up, but like just your P&L,
Profit.
right? Isn't it
Yeah.
your proper role
Yeah.
and really, understanding what drivers of the profit are. Yeah.
Interesting. Financial
One,
metrics.
again, that's probably at where I'm at. And I've been a business owner for nearly 25 years. So you've, it's different for everyone dependent on where they are in their business journey. Yeah. I mean, profit, if you didn't want to use that and we, going with culture and going with what we talked about recruitment, if we're making the assumption that we more often than not just hire good people, then a very good key metric will be your ability to retain those people, right?
Yeah, I
Right?
mean, yeah, I love what you're saying. It's kind of like, yeah, I think you told me in our past chats that you hire very, very slowly.
Very,
Right.
but yeah,
Yeah,
again,
yeah.
that's a commitment from our group of directors that we're not pushing growth for growth's sake. But if you come from a different business model, maybe you don't have that luxury. And the KPIs that have either been set by your other owners or you set for yourself maybe doesn't allow you to hire very slowly, which then means you then make sure your culture is excellent and you've got such good systems in place so that you can induct, train staff and retain them very, very well.
Mm,
Yeah. So,
yeah.
but if you're relatively new to business and yeah, and things are just generally hard and you feel like you're scrimping trying to make the books in the black, maybe change the metric. Maybe the metric is like you need to make sure you retain your one physio or your two physios and make sure reception is a wonderful receptionist and they don't leave, keeping you in the lurch. That might be a very key metric. Because if you can maintain for a long time, hopefully that turns all your books better, right? So I think it's hard. One metric's really hard. I think it depends on definitely on context.
Interesting.
Yeah.
So, what's one lesson you've learned running a multidisciplinary clinic and allied health
You
one
know,
specific?
I'm not sure whether I'm gonna turn
Go
heads
for it.
here. I might preface by going, yes, I'm a physio, and I could have done a whole lot better job managing teams of physios. I think where I ended up struggling was because I'm the managing director of our group, BJC Health, and we're a group of 70 now, is I need to understand various segments of business, and perhaps this is my excuse. And so I haven't been really able to focus on the physio team solely and making sure they're doing as well as they potentially could. And so perhaps one lesson, I think it's, you can find excellent allied health managers. And if they only come from one profession, they can manage multiple allied health streams. But I think if you really wanted to truly grow physiotherapy or exercise physiology or podiatry or massage therapy, and you wanted to grow with great clinical governance, you need the leader or the manager there to be from that allied health stream.
So it's
Yeah.
tribals. Yeah.
Right.
Okay.
I think, I'm sure there's examples out there that people
Yeah.
have done wonderful jobs,
Yeah.
but I think you need that firepower either through consultancy or somewhere. That's one. I think the business of allied health, sorry if I can give you one more lesson, is really, really hard and it's getting harder. I'm lucky I've been doing this for a while now and we're relatively established, but trying to make it work in the current economic climate and how high wages are, yeah, really make sure you have a good business plan and you're ready to work super hard as a founder. Not the same as what it was 30, 35 years ago when you could open up practice. The competition is rife. It's everywhere. And the numbers don't fully stack up. Yeah. Especially when we got the workforce report in 2024 and you see, I think the numbers were physios that were 5 to 10 years out from their degree were earning about 100K. Yeah. That's not great in 2026. Yeah. With a standard of living crisis that we're going through.
Not really. There's not much kind of aspirational stuff there, is it? Like for a physio to work towards as a new grad.
Yeah, it's hard. Yeah. So you got to be prepared and ready for that. And then I'm going to make the assumption that most of us want, even if you're a new grad, and definitely as a new grad, you want to do great clinical work. And if you want to do great clinical work, that requires you to spend time with patients. There's no easy way, and you got to charge for that time. And then the question is whether you can show value for what you need to charge for the practice to be viable.
Very difficult one. Very difficult.
Yeah.
Anyway, I'm just going to wrap up. So, last comment is there, what are you looking for at the moment from our audience, if anything?
In what sense,
If
Eric?
you want to speak to other practice owners or is there
Oh,
anything
right. No, I'm nothing in particular. I'm happy to, I don't know how much wisdom there is, but I'm happy to share all wounds as you've mentioned, Barry, and help people who are really interested in growing business. It can be fairly lonely being a business owner and a founder. So I think the more of us that can come together and build a community where we share knowledge and share that oftentimes are tough, but you've got support around you, I think that would be best. And then the more collegiate we can be, the better our profession can be in the long run.
Very interesting. So am I assuming that you find the current platforms aren't doing that well enough? Like, there's Facebook groups and
No, I don't. I
no.
think people, but not everyone's on it.
Yeah,
And
that's what I
sure,
noticed.
not everyone might want to be in a Facebook group.
Yeah.
People are all different. I think more and more also, I think interaction in person
Yeah,
is great.
I've absolutely noticed that. I think even for CliniScribe, like the best distribution, oddly, is actually face to face
Yes.
for software, right?
Yeah. Is that? I mean, I
Yeah.
just learned that recently on a trip overseas.
Yeah.
Pressing the flesh with someone physically and talking to them, you get so much in a very short space of time compared to spending hours online.
Yeah. Yeah. Because
Yeah.
there's a lot of keyboard warriors, as we know,
Yeah. And I think it's hard as a business owner when you're under stress and someone's just left your practice and you're going to have to pick up the load. You just don't have the headspace. So maybe sometimes you just need to like rant to someone for 15 minutes and that's enough to help you. So I think more mentors, more people seeking mentorship, more simple networks, more local networks.
Yeah.
Not like I've gone out there and tried to build a lot myself, but I think if we had more of those perhaps more people feel supported and then they're more willing
Yeah.
to have a go.
No, that's great to hear. That's a validation for what I'm trying to do here because I meet so many practice owners now. Like
Yeah.
every day, I'm like, might as well leverage that and get everyone together as a community because everyone's like-minded here. So
Yeah.
I'm thinking moving forward. I mean, stay tuned, but like running a lot of face-to-face events
Yeah, absolutely, Barry. Well
in
done.
local.
You're doing a great job.
Thank you.
Keep it up,
All right.
Barry.
Thanks, Errol. Thanks for your time.
No, pleasure.